Good morning everyone. Welcome back to Nursing Guru. Today we are going to discuss about a fourth unit from applied psychology, that is developmental psychology. Okay. Today we are going to discuss about a fourth unit from applied psychology, that is developmental psychology. Okay, before going to start this developmental psychology, we should know about some basic terms. So which are all that basic terms we can start now? Growth and development. Okay, growth, it means it's a physical maturation. Okay, physical maturation, that it will be includes multiplication, okay, increasing in the size. Okay, physical improvement, it's a physical maturation, that we will call it as growth. Okay, development means what? Development in the sense it's a physiological maturation. Okay, physiological maturation of individual, it's a qualitative maturation, qualitative development. Growth means it's a quantitative maturity. Okay, this is about growth and development in the developmental psychology. Okay, next we can move towards to developmental psychology. So developmental psychology means what? Okay, what it will indicate or what's the meaning of it? Developmental psychology, it deals with the factors which is influencing growth and development. Okay, which are all the factors which are responsible? Okay, what are all the factors which is responsible or which is influencing growth and development? That we will call it as developmental psychology. Here many developments are there. Okay, three variety or three various types of development are there across the lifespan. Okay, that we can start now. In that, first one is physical development across the lifespan. Okay, physical development across the lifespan we can discuss step by step. Okay, level by level. So what is the first one? First one is prenatal. Okay, first one is prenatal. Prenatal means what? Prenatal in the sense when the conception process it will start. Okay, from conception process to till childbirth. Okay, conception process it will takes place, then zygote formation, after zygote formation fetus development or embryo development in the uterus of the mother until childbirth, until delivery. That duration we will call it as prenatal. Okay, and second one is infancy and toddler. Okay, second one is infancy and toddler. Infancy and toddler, it will start from birth to till 2 years. Okay, infancy and toddler, it will start from childbirth to till 2 years. In this duration, what are the physical development we can see? We can observe means, okay, increasing in the weight, baby weight, increasing in the baby height. Okay, baby physical development, it will takes place here. Okay, and baby, it will start to see the things, start to understand the things. Okay, this is about infancy and toddler from birth to till 2 years. Okay, and next one is early childhood. Okay, early childhood. Early childhood. This early childhood, it will start from 2 years to 6 years. In this duration, we can see the child, it will involve in some activities. The child, it will participate in some games, okay, playing some games, activities, physical activities. Their sensory motor skill, it will develops here. So in this duration, in this early childhood, baby motor skill and sensory skill, it will develops, it will takes place here, that it will improve, it will enhance here. This is from 2 years to 6 years, early childhood. Okay, and next one is middle and late childhood. Okay, middle and late childhood, this it will start from 6 years to puberty. Okay, this early, middle and late childhood, it will start from 6 years to puberty. Okay, in this duration, that baby, it will involve in academic activities. Okay, they will show the interest towards their study, they will start to go to the school. Okay, their sensory skill, it will improve here. Sensory motor skill development, it will takes place, it will develops in this duration. Okay, and also they will improve. Okay, they will improve their understanding skill here. Okay, here their physical growth, it will takes place. Okay, their coordination, okay, muscle coordination, physically they will grow here, gradually they will grow physically. Okay, this is about, okay, from 6 years until puberty, middle and late childhood. Okay, next one is adolescent. Okay, next one is adolescent. Next one is adolescent. These adolescent, it will start from puberty to till 18 years. Puberty to till 18 years, it will takes place. In this duration, their sexual characters, it will develops. Okay, sexual organs, sexual characteristics, it will develops here. And also it's a rapid physical growth. In this duration, we can see a rapid physical growth, and also sexual organs, it will develops here. This is about adolescent from puberty to till 18 years. Okay, and next one is early adulthood. Okay, early adulthood. Next one is early adulthood. It will start from 19 years to till 40 years. 19 years to 40 years. In this duration, they will get their physical fitness. Physically, they will get balanced. Okay, physical fitness, physical balance, and their neuronal functions, their sensory functions, their neuronal functions, it will improve here. Okay, this is about early adulthood from 19 years to till 40 years. Okay, and next level, next step, next one is middle adulthood. Okay, next one is middle adulthood. Middle adulthood, it will takes place from, it will start from 40 years to 65 years. Okay, middle adulthood, it will start from 40 years to 65 years. In this duration, okay, their muscle elasticity, their skin elasticity, it will change, it will decrease. Okay, their hairs, it will start to it will start gray hair. Okay, gray, that their black hair, it will turns into gray hair or white hair. Their physical strength, it will reduce here, it will decrease here. Their skin elasticity, muscle elasticity, everything, it will be decrease here. Okay, and also their hair, physical changes we can observe. Their hair, it will turns into gray or white color. This is about middle adulthood from 40 years to 65 years. And last one is late adulthood. Last one is late adulthood. Last one is late adulthood. It will start from 60 years and above. Okay, 60 years and above 60 years or 65 years, 70 years. It will above the 60 years. In this duration, completely their walking style, it will change, their posture, it will change. Okay, and also they are highly risk for cardiovascular disease, diabetes, hypertension and all. Okay, in this duration, their strength completely, it will low, completely it will decrease. Their posture, it will change. Okay, their physical energy, physical strength, it will decrease. Okay, and they are highly risk for physical diseases, infections and cardiovascular diseases. This is about later adulthood. So far we have discussed about physical development across the lifespan. Okay, and our next one, second important thing is psychological development across the lifespan. Okay, psychological development. Psychological development across the lifespan. Here we can discuss step by step, level by level. Okay, what is the first one? From birth to till 1 year. Okay, from birth to till 1 year, trust versus mistrust. Trust versus mistrust from birth to 1 year. In this duration, that child, okay, that trust it will develops when the basic needs are met, okay, like likes and dislikes, food, water, shelter, okay, they are basic needs, okay. When the child basic needs are met by others, the child trust it will develops over there, okay. Trust versus mistrust from birth to till 1 year, okay. This is a first psychological development across the lifespan, okay. Second one is autonomy versus shame. This it will start from 1 year to 3 year, okay. Autonomy versus shame, it will start from 1 year to 3 year. In this time, in this duration, that sense of independence, sense of development, okay, sense of independence towards the task it will develops here. And also that child, they will feel guilt when they will get failure or when they will get unsuccessful, okay. Autonomy versus guilt or shame, okay. This it will start from 1 year to 3 year. In this duration, that sense of independence in the task, towards task, it will develops here. And also that child, they will feel guilt and shame when it will get failure or when it will get unsuccessful. This is about a second psychological development, okay, from 1 year to 3 year. And next one is initiative versus guilt, okay. Initiative versus guilt. This it will start from 3 years to 6 years. Initiative versus guilt from 3 years to 6 years. In this duration, the child, they will show their participation, active participation in every task. They will take initiative to do the work, to complete the task. They will show active participation, they will take initiative, and also they will get guilt if it is not working, if it is not getting success. This is about initiative versus guilt from 3 years to 6 years, okay. And next psychological development is industry versus inferiority. Industry versus inferiority from 7 years to 11 years. Industry versus inferiority. Industry versus inferiority from 7 years to 11 years. Industry versus inferiority, it will start from 7 years to 11 years. Here the child, they will get confidence, they will get willpower. Yes, I will do anything, it's a possible thing, nothing is impossible, I am ready to do this, like that. They will, their confidence level, it will improve here, their willpower, it will develops here, okay. Industry versus inferiority. And also they have sense of inferiority here, okay. This it will start from 7 years to 11 years. Industry versus inferiority. And next one is identity versus confusion, 12 years to 18 years. Identity versus confusion from 12 years to 18 years. Identity versus confusion. Here their roles, their responsibility, their identity, it will recognize here. Identification of their roles, their responsibility and their commitment, it will be divided here. They will try to understand what is their role, what is their responsibility, what's their commitment. They will understand here, okay. This is about identity versus confusion from 12 years to 18 years. And next psychological development is intimacy versus isolation from 19 to 29. Intimacy versus isolation from 19 to 29. Intimacy versus isolation. So intimacy versus isolation in the sense that people, that individual, they will start to be involved in the relationship, family commitment, okay, be a part of society, okay. They will start to show their intimacy in the sense being involving in a relationship, friendship, okay, getting marriage, okay, family commitment, family rule. This is about intimacy versus isolation from 19 years to 29 years, okay. This is about this psychological development of intimacy versus isolation. And next one is generativity versus stagnation from 30 years to 64. Generativity versus stagnation. Okay, generativity versus stagnation from 29 to 40. 29 years to 40. Okay, generativity versus stagnation. In this duration, that individual, they will start to build their career and they will try to get a good position. Okay, they will start to choose their life partner, they will start to build their career, and also they will try to be in a good position. That is about generativity and stagnation from 30 years until 64 years. 34 years to 64 years. Okay, and next one is integrity versus despair. Okay, 65 above. Okay, integrity versus despair. Integrity versus despair. 65 above. Okay, integrity versus despair, it will start from 65 years above. In this duration, it's a retirement status. Okay, this 60 years, 65 years and all, it's a state of retirement. In this time, they will take retirement, they will take a break from their work, from their profession, they will take a break. It's a retirement state. And also they are completely, okay, their physical changes we can observe. Okay, physical changes, okay, their strength it will lose, okay, their brain activity, neuronal activity, it will be decreased. And in this time they will get some, what we can say, some memory loss problem, okay, memory disturbances and all they will get here. Okay, integrity versus despair, it's a decline phase. Okay, it's a near to death phase. In this time we can observe physical changes, and also it's a retirement state, retirement process. They will take a break from their work or from their job, and it's a decline phase. This is about integrity versus despair, 60-65 years above. Okay, so far we have discussed about psychological development across the lifespan. So this is about psychological development. And our next important development is cognitive development. Okay, cognitive development across the lifespan. Cognitive development. Cognitive development across the lifespan. In this, first one is infancy. Okay, first one is infancy from birth to till 2 years. Okay, infancy from birth to till 2 years. This duration we will call it as infancy from birth to 2 years. In this duration, the child sensory motor skill it will develops here. The child, it will start to understand the world, it will start to seize the things. That child, it will start to understand what's the world, what they are trying to say, what they are doing. That child, it will start to expose to the world. Their sensory motor skill it will develops here from birth to till 2 years. This is infancy stage. Okay, infancy stage or state. And second one is early childhood. It will start from 2 to 7 years. Early childhood from 2 to 7 years. Early childhood. In this duration, okay, the child, it will start to show the symbols to represent the things. That child, it will start to show the symbols, it will start to show the gestures, symbols to represent the things. This is about early childhood. It will start from 2 years to 7 years. Okay, and next one is middle and later childhood. Okay, middle and later childhood, 7 to 11 year. Middle and late childhood from 7 to 11 years. Okay, in this time, that baby learning ability, it will improve. Okay, learning ability, academic interest, okay, that child, what we can say, curiosity to learn new things, okay, academic interest, academic, that learning ability, it will improve, it will develops in this time from 7 years to 11 years, middle and late childhood. In this duration, that child, they will show the more interest towards their study, towards their subjects, okay, they will involve in reading, writing, okay, phrases, okay, they will try to speak the language also, they will try to understand and speak their language. Okay, this is about middle and later childhood from 7 years to 11 years. Okay, next one is adolescent. Okay, adolescent, it will start from 11 years to 16 years. Adolescent from 11 years to 16 years. In this group, sorry, in this adolescent stage or development, they will think logically. Okay, from 11 years to 16 years, that child, they will start to think logically, and they will try to manipulate their ideas. Okay, they will learn manipulation of ideas, and also they will start to think logically. Okay, this is about adolescent from 11 years to 16 years age group, 16 years stage, adolescent group. And next one is adulthood. Okay, adulthood from 17 years to 60 years, from 17 years to 60 years, adulthood. In this time, they will try to build their career, they will get the solution for their own problem, solving their problem. Okay, solving their problem, they will get solution to solve their problem, they will build their career, they will choose their family responsibilities, they will choose their life partner, and also they will involve, they will be a part of society. In this, they will understand the social ethics, social responsibilities. Okay, this is about adulthood from 17 years to 60 years. They will understand, they will try to expose to the world, and they will get life experience in this duration, adulthood from 17 years to 60 years age group. And last one is elderly, 60 years and above. Last one is elderly, 60 years and above. Elderly group means they are highly risk for cardiovascular problems, diabetes, hypertension, joint problem, they are risk for infections, and in this time we can observe a lot of physical changes in them. Okay, elderly people, lot of physical changes we can observe in elderly people, old age people, and also they will get variation. Okay, they will get depression, sorry, they will get decrease in their thought process, their thought process, it will change. Okay, their thought ability, cognitive ability, it will reduce here. Okay, they will get short term memory loss. Okay, short term, they will forget what they have done before. Okay, past experience, they will forget. Short term memory loss. Okay, their thought process, it will be very slow here, their cognitive ability, it will decrease here, and also they are risk for other physical diseases. This is about elderly people, elderly from 60 years and above 60, 65 years. This is about cognitive development across the lifespan. So far we have discussed about physical development across the lifespan, psychological development across the lifespan, and cognitive development. Okay, 3 developments across the lifespan we have discussed till now. Okay, and our next important topic is psychological needs. Okay, psychological needs in the various group. Okay, psychological needs of various groups in health and sickness. Okay, when they are ill or when they are sickness, when they are sick. Okay, what's their psychological needs, what they want, that we can discuss now as per different age group, as per different various group. In that, first one is, okay, I'll write heading psychological needs among various groups. In that, first one is infancy. Okay, infants. For infants, what they are expecting, what's the psychological needs of infants, in the sense they need love, they need affection, okay, love, affection, okay, understanding, warmth, protection, okay, they need understanding, they are expecting physical contact from their parents, okay, like always they want to stay with their parents. They, if their parents are not there near to them, means they will start to cry, okay, infant children. So they need love, affection, that bonding, understanding, that warmth, okay, that safety, that security they need in the infants, okay, infants group, infants children, they need this one, psychological needs of infants group. And what's the role of nurse here? If infants are getting admitted to the hospital, what's the role of nurse here? In the sense they have to observe closely, okay, close monitoring of the infants, and also teaching to the, giving health education and giving care, special care to the child, close monitoring, special care, giving health education, teaching to the child parents, okay, what they should do, what they should not do, everything they have to teach. And also provide some toys, okay, provide some toys, play, and make the child to participate in some playing activities, in some games. So the nurse has to divert the child mindset. So this is about role of nurse, okay, psychological needs of infants and also role of nurse. Okay, second one is childhood, during childhood, okay, second one is childhood. Second one is childhood. In the childhood, same thing, almost similar. The child, they need, children, they need love, affection, that connection, bonding, protection, nutrition, nourishment, okay, these and all are the, these are all the psychological needs of children, okay, they are expecting, they need this one, protection, nourishment, nutrition, understanding, love, affection, care, safety, security, everything they need here, okay. And what's the role of nurse if children are getting admitted to the hospital? What's the role of nurse? We can see here, role of nurse, the nurse, she has to provide comfortable position to the child, that's the first thing, okay, calm and quiet environment, okay, provide comfortable position to the child. And also parents should stay with that child, okay. And if the child he is crying, nurse has to know what's the reason behind that cry, okay, why the child is crying, the nurse has to understand the reason. And also if any changes, behavioral changes, or any manners changes in their manner, in their attitude, in the child behavior, immediately nurse has to recognize the changes, immediately she has to recognize, okay, what are all the changes. This about childhood, okay. And next one is late adulthood. In late adulthood, what are all the needs, psychological needs of late adulthood? Psychological needs of late adulthood. And what's the role of nurse? Same thing here, they need freedom, they need independence, they need protection, okay, they need love, they need affection, okay. This is about adulthood, late adulthood, okay, they need security. And what are the role of nurse? Okay, if they are getting admitted, or if they are ill, if they are sick, what's the role of nurse? Nurse, she has to say about the condition, okay, she has to give attention, complete attention she should give to that patient, okay. And close monitoring, if any changes are there, immediately she has to recognize that changes and she has to inform that to the doctor, okay. And next one is adolescent, okay. Next group is adolescent group. What are all the psychological needs of adolescent group? Okay, what's the role of nurse here? Means they need complete independence, they need security, independence, freedom, and they need satisfied life, okay. They need satisfied life. And opposite, they need orientation to the opposite gender here, okay. And what's the role of nurse here? In the adolescent group, means she has to explain the procedure to the patient, Okay, she has to explain, and what patient has to do, what he should not do, everything she has to explain to the patient. Okay, about the procedures, about the treatment, about the patient condition. Okay, and she has to explain about rules and regulations. Okay, this is about psychological needs of adolescent and also role of nurse. Okay, and next group is early adulthood. Next group is early adulthood. So in early adulthood, what their needs, what are their psychological needs, in the sense they need balance of intimacy, independence, satisfied life and commitment. This is about psychological needs of early adulthood, and also they need independence. So what's the role of nurse here? A role of nurse here is complete explanation. Okay, the nurse has to explain their responsibility, their role, and explain the procedures, what they are going to do, or what they are going to plan. Okay, this is about role of nurse. And early treatment and diagnosis also, it's important. If their diagnosis has confirmed, means that has to inform to the patient. Nurse, she has to inform about the diagnosis, about the treatment, and about the procedures, what they are going to do or what they are planning to do. Okay, this is about role of nurse in early adulthood group. Okay, and next one is middle adulthood. Okay, middle adulthood. Middle adulthood. Okay, in the middle adulthood, what's their psychological needs, in the sense they are expecting good position in the society, they need good position, they need good standards. Okay, they has to lead standardized life, they're expecting good standard, they're expecting good position in the society. Okay, middle adulthood. Okay, and they will produce the children into the society to live, they will produce their children, they will launch their children into this society, into this world to live. Okay, this is about middle adulthood. Okay, and what's the role of nurse here? In this time, the people, they are risk for physical infections, physical diseases and other cardiovascular diseases. Nurse, she has to take care of that. Okay, early detection and diagnosis, and what are all the symptoms, early, based on the symptoms they have to recognize, special care, they have to give special attention, special care, close monitoring of the people, of the patient. This is about middle adulthood, role of nurse and psychological needs of middle adulthood. And next one is, okay, later adulthood. Okay, next one is later adulthood. In this later adulthood, next one is later adulthood. In the later adulthood, what are all their psychological needs? They need self-image, they need standardized life, satisfied life. Okay, and also they need responsibility, social responsibilities they need. This is about psychological needs of, psychological needs of later adulthood. Okay, and next one, role of nurse. So what are the role of nurse here, in the sense, in this time, patient, in this duration, in this age group, patients are admitted to the hospital more. They will admit to hospital more. In this, why they will admit more, in the sense, after getting a age, after crossing 60 years or 50, 55, 60 years, they are highly risk for infection, they are highly risk for physical diseases, cardiovascular problem, metabolic problem, hypertension, diabetes. They are highly risk for physical diseases as well, cardiovascular diseases. So that's the reason, in this age group people, in this duration, they will admit to hospital more. Okay, this is about role of nurse. In the role, what's the role of nurse here, in the sense, she has to give more attention, she has to give like a close monitoring. Okay, balance, what we can say, calculation of their intake and output, close monitoring, provide comfortable position, checking their vital signs continuously. Okay, vital signs she has to check. Okay, provide proper care to them, special care to them. Okay, this is about role of nurse in the later adulthood people. Okay, this is about psychological needs and role of nurse. Okay, so far we have discussed till this much. Okay, our next important concept is introduction to child psychology. Our next important concept is child psychology. Child psychology. So child psychology means what? Child psychology in the sense they are observing. Child psychology deals with the any changes, behavioral changes or any other changes in the children child group. They will recognize, they will deals with that. Okay, changes in the child personality, child behavior. This is about child psychology. After this, okay, in the child psychology, some role of nurse are there. Okay, what are the role of nurse in child psychology? We can discuss one by one. Okay, role of nurse in child psychology. First one is care provider. Okay, primary care provider. Care provider. First one is care provider. Care provider means, as you know, nurse, she has to give special care to the children. She has to take care of the child. Okay, everything she has to take care, like close monitoring, checking vital signs, feeding to the baby, bathing to the baby. Okay, and also complete close monitoring. Okay, how I can say that nurse, she has to give her attention to the child, to observe everything, to observe each and everything, like what are the behavioral changes, what are all the changes, any changes in their mannerism, any changes in the behavior, any changes in the attitude, everything she has to recognize only through the close monitoring. Okay, close observation. So care provider role means she has to give special care to the child, proper care, special care, qualitative care to the child. Okay, second role is health educator. Second role is health educator. Second role is health educator. Okay, health educator means nurse, she has to give health education to the parents. Okay, she has to teach to the child parents what child has to do, what child has not to do, you should not do. Okay, and what's the parents rule, what's the parenting, what are all the measures they have to take, how to take care of children, everything nurse, she will teach, she will give education to the parents. So these are role of nurse, health educator. Okay, and next one, next role is counselor. Next role is counselor. Counselor. So counselor means that nurse, okay, she will give directions to the parents, she will give counseling to the child. Okay, she will give directions, counseling to the parents. Okay, how to take care of child. Okay, what are all the if any changes are there, what measures parents has to take, everything they will teach here about child rights and all. Okay, about safety. Okay, safety measures of child, everything they will teach here. They will say to parents, they will take a counseling session to the parents and child. This is a counselor role of nurse, counselor. Next role is coordinator and collaborator. Okay, coordinator and collaborator. Coordinator and collaborator. Coordinator and collaborator means nurse, she has to show their coordination. Nurse, she has to work coordinately with their health team, with their healthcare team, and also with the patient family members or parents. She has to work with the understanding manner, with the very collaboratively. Okay, with that coordination has to build there. Okay, between the nurse and healthcare team, between nurse and patient, between nurse and family members, means parents. Okay, that patiently she has to work. Patience is important here. Okay, coordinator and collaborator. This is about role of nurse in child psychology. Okay, and next important topic is psychology of vulnerable individuals. Okay, psychology of vulnerable individuals. Vulnerable individuals. psychology of vulnerable individuals. So before going to start this topic, you have to understand what's the meaning of vulnerable groups. Okay, vulnerable groups in the sense those people or belongs to society, they are oppressed or susceptible to harm. Okay, those people or belongs to society to oppressed or susceptible to harm, that group we will call it as vulnerable group. Okay, psychology of vulnerable groups, that we are going to discuss now. That's our topic. In that, first group is women's. Okay, first group is women's or women. First group is women. Okay, women, I like being a wife, being a mother, it's very difficult to manage. It's very difficult to balance. In case if they are working women, it's highly difficult. It's more difficult to manage their family, manage their job, their profession. It's difficult. So in this women group, like we can observe many changes. We can observe what we can say, we can observe consequences, some problems, some difficulties we can observe more in this women's group. So what are the reasons for that? What are the reasons for this problem, these consequences? That reasons we can discuss now. So that reasons are infertility. Okay, infertility, it will affect to their mind, it will impact on their mental health. Okay, infertility not only for women, for also men. Okay, infertility, infertile women, it will impact on their mind, it will impact on their psychological aspect. And next reason is unwanted pregnancy. Okay, unwanted pregnancy, that it will affects on their emotions, it will change their emotions. Infertility, okay, unwanted pregnancy. Okay, then violence from their spouses. Okay, violence from their spouses means from their husband. Okay, violence from their husband, these also main reason for that consequences. And what we can say, victim. Okay, victim of rape. Okay, victim of what we can, sexually harassment, or victim of violence. So these are all the reasons. Okay, these are all the reasons for consequences that women's group. So women's are a vulnerable group. So these are the reasons which we have discussed now. Okay, and second group is sick person. Okay, psychological needs of sick person. Sick means nothing like ill. Okay, sick person, sick group, or ill group. Okay, it means illness or sickness, it will impact on their mental health. Okay, physical health, it will impact, physical diseases, it will impact on their mental health. It's like a vice versa. Physically if they are getting imbalanced, or physically if they are getting problem, means it will affect on mentally if they are getting any problem, means that it will affect on physically. It will start to show the symptoms by physical. So here, any severe situations, severe conditions, or critical conditions, that it will affect on their mental health. Okay, life threatening conditions. Okay, and what we can say, that which condition it doesn't has a medicine, doesn't has a treatment. So these kind of diseases, it will affect on their mental health. Okay, in this, a more important thing is early detection and diagnosis. If they are detecting early, we can go for further treatment or further measures we can take. Like they are if they are not maintaining that, if they are not aware of their disease, or if they are making delay, or if they are doing negligency, it will leads to further complications. So early detection and diagnosis is very important. Prognosis is very important here. Okay, next group is during illness. Okay, sorry, psychology of caregivers during illness. Like illness is very serious, but prognosis is poor, that also it's a impact. Okay, illness is very serious, severe, but prognosis is poor, that it will also affect on mental health, it will also affect on psychological health. Okay, and next one is loss and grief. Loss and grief. Loss and grief. So loss and grief means, example, a death of loved person, or loss of favorite person, death of favorite person or loved person, they have passed away. So that it will cause mourning, or that it will cause bereavement or grief. So this is about loss and grief. Next we can go to the, what we can say, three states. Okay, three states are there. Three states of awareness surrounded by the dying person. Okay, three states of awareness we can discuss now. Three states of awareness. First one is closed awareness. Second one is mutual presence. Third one is open awareness. Okay, first one is closed awareness, second one is mutual presence, okay, and third one is open awareness. So we'll start this discussion one by one. First one is closed awareness. Closed awareness means what? Okay, closed awareness means about the patient condition nobody knows, okay, that patient is going to die. Even patient or patient family members or health, that surrounding people, relatives, nobody knows about it. Nobody knows about the patient condition. Okay, that is closed awareness. Okay, second one is mutual presence. In this mutual presence, only family members and caregivers, health caregivers, okay, healthcare professionals, only family members and healthcare providers, healthcare caregivers, they only knows the truth. But patient, he do not know about anything. He do not know about his condition. Only family members and caregivers, they knows about the patient condition, patient situation. But patient, except a patient, everyone knows about the situation, about the condition that he is going to die. And last one is open awareness. Open awareness. So open awareness means what? Okay, open awareness means everyone knows about the situation. Even patient, family members, their relatives, healthcare professionals, healthcare providers, everyone knows about the situation, about the patient condition, that he is going to die. He is not living more, like that. Okay, everyone knows about that situation. This is about open awareness. So this is about three states of awareness surrounded by the dying person or dying individual. Okay, closed awareness, mutual presence, and open awareness. Okay, and our last topic from this developmental psychology is grief. Okay, last one is grief. Okay, grief means what? What's the meaning of grief? Grief in the sense exceed level or excessive level of sadness. Okay, like how I can say grief in the sense bereavement, mourning, we will call it as mourning. Grief in the sense mourning and bereavement. Mourning and bereavement. Extreme sadness. Okay, extreme sadness. Example, a favorite person, okay, or loved person, they have passed away, they have died, they have passed away. So that's the reason for grief. Okay, mourning, bereavement means extreme level of sadness. That is, we will call it as grief. So grief, it has 5 stages. Okay, grief, it has 5 stages that given by Kubler-Ross. Okay, Kubler-Ross given 5 stages of grief, that is denial, anger, you can keep it as a mnemonic, dabda. Okay, denial, anger, bargaining, depression, and acceptance. Okay, Kubler-Ross, he has given 5 stages of grief, that is denial, anger, bargaining, depression, and acceptance. So what's the meaning of denial? Okay, denial in the sense that patient or that group of people, they are not ready to accept the things. They used to refuse. Example, his friend, best friend, or his family members, they have passed away, they have died. So what's their reaction? What will be their reaction means they will start to refuse. Okay, they are not ready to accept the reality. No, you are saying lie. Okay, yesterday only I have seen that person, how he can die today, how he has passed away today, like that. They will get that, they will start to refuse the things. They are not ready to accept the reality, that is denial. And second stage is anger. Anger in the sense, they will show their aggressiveness, angerness. Why always it will happens to me only? Why I have to suffer always? Why me, like that they will get question. Okay, and they will show their aggressiveness, they will show their angerness towards the group, towards others. And third stage is bargaining. In the bargaining stage, what they will do, they will make a demands. Okay, they will make a demands, like a, please God help me, if you are helping me, I'll come to temple every Sunday. I'll donate my money to the temple or the trust. I'll come to church every Sunday, like that. They will make a demands. God, if the God is helping me, I'll ready to do anything. I'm ready to do anything, like that. They will make a demand. That is bargaining stage, third stage of grief. And the fourth one is depression. Depression stage means, you might be know about depression. Depression means they are in a absence minded mode. Okay, aloof mode, like whatever it will happens, okay, why it's happening, why I did what I did, everything, why it's happening to me, like that they will react. Depression mode. Okay, completely they will fed up with the things. That is depression stage of grief, fourth stage. And last stage is acceptance. In the acceptance stage, they will move on. Okay, they will accept every reality, they will accept the things, and they will move on to the, they will think about future and they will move on. This is about fifth stage of grief, that is acceptance. So far we have discussed about these stages. Okay, Kubler-Ross 5 stages. Okay, this is about developmental psychology. So far we have discussed about introduction to growth and development, developmental psychology, physical development across the lifespan, okay, cognitive development, psychological development across the lifespan, psychological needs of different group or various group, and introduction to child psychology, and also that individual, okay, psychological needs of vulnerable groups or vulnerable individuals. And we have discussed about grief, loss and grief. So this is about a complete details class of this developmental psychology from applied psychology, fourth unit.